This exercise is called VMO timing contraction. The VMO stands for vastus medialis obliquus, which is the inner portion of the quadriceps. The outer portion of the quadriceps is called the VL, or vastus longus. And normally when our quadriceps contracts to straighten our knee, the different heads or portions of the quadriceps contract with slightly different timing. So normally the VMO, or the vastus medialis obliquus, contracts a split second earlier than the rest of the quads because its muscle fibers attach to the kneecap, so it actually helps stabilize that kneecap position before the powerful force of the rest of the quads straightens the knee and puts a lot of force through that kneecap. So that's what happens in a healthy leg. What can often happen though is that timing becomes aberrant, and instead of the VMO contracting a split second before the rest of the quads, it can start to contract a split second after the rest of the quads. So this exercise is about retraining that timing. So we're going to contract our quads, and we're going to concentrate on trying to have the inner portion, the VMO, contract a split second before the rest of the quads. So you can build the tension up in the muscles slowly. And what helps, just as a form of feedback, is to actually squeeze the muscle between your hand or between your thumb and fingers, just so that you can feel what those different parts of the quads, the VMO and the VL, are doing. So you contract the muscle, but by having your hands there, it just lets you feel which part is contracting first. And sometimes as you're learning to do the movement, they contract at exactly the same time. But with enough practice, we want this inner portion to contract first. So we build the tension up slowly, and once the tension's built up, we then relax and repeat, trying to focus on getting that inner portion, the VMO, to switch on first.